To start off, the Battelle Developmental Inventory is a comprehensive developmental assessment for children, and it's used as a tool in the research community to assess if there are any developmental delays in children from birth to age 7. We used it on a 5-month-old who was born 3 weeks early and was intrigued about if she had any delays or was progressing quicker, I guess. So the history of the Battelle Development Inventory, this is actually the 2nd edition. It was redesigned, I guess. Redesigned from the first one after the IDEA was developed in 1988, something. But basically, the states were given an incentive to give children access that they needed to help with their any developmental delays that they had, and the Battelle was a way to assess where they needed that interventions.
So, as Michelle mentioned, the Battelle Index has a wide range of domains, and these domains are basically what area the child is being assessed in. There's the personal social domain, which has questions such as, do they look at an adult's face? Do they respond physically when they're held? And as they get older, the questions become more specific to what they're trying to do. So, for instance, the look at an adult's face is specifically for a 0 to an 11-month-old, whereas for a child who's 5, they're specifically asked to ask for an adult for help when they need it, or following the adult's directions with little assistance. Then there's their adaptive domain, which is self-care. So for their 0 to 11 months, it's more looking at their reflexes. Do they suck with smooth, coordinated movements? Do they place both hands on a bottle when they're being fed? As they become older, are they potty trained yet? Do they dress or undress themselves? This is what I'm looking at to answer all of your questions, or give examples of all of these things. This is the specific form that the administrator would fill out. And the test can be done with either an interview to a parent or caregiver if the child isn't easily accessed. Ideally, it's done through observation of a child rather than interviewing of the parent. But if necessary, for instance, Isabella was not as cooperative towards the end of our session, so and she needed a nap. So we let Mom lay her down. Mom finished answering the last of her questions so that Isabella could nap. It also looks at the 3 other subdomains are motor, communication, and their cognitive skills. The scores of 2, 1, or 0 basically mean a score of a 2 is the highest that they can receive and is that milestone achieved. Are they able to hold their head up? Are they able to follow a light source? A score of a 1, that milestone is emerging. So they kind of get the idea of following a light source, but they only follow it until they can't see it anymore. Or they understand that there's sound and they look towards that direction, but they don't finish or seek that sound. A score of 0 just means that it's not there. And then also on this chart, it requests if you observe the skill, if it was an interview, or if you asked the child to do it.
So while administering the test, the child may be very flighty, so you might want to get everything done that you can. So you might go out of order. then finish the interview questions with a parent or caregiver at the end. If when you're going through and checking off the questions, the child receives 3 zeros in a row, that is when you are supposed to stop the test. And even if you completed some of the tasks with the child in other categories, those don't count. This is where you draw your ceiling. It's basically to say that the child has reached their mastery in a certain range, and after that is where they will start to develop, or this is where they need work. And that's not to say it's in a different category, but like it's in one domain. If you are ahead a few questions, if you're ahead a few questions, then those don't count. But if you had done like gross motor and then you're in fine motor, those are still separate. It's just in the domain. If you get 3 zeros in a row, that's when you would know that the child has reached the developmental stage of where they're at. So.
The age for the Battelle Index is from birth to 7 years and 11 months. So this has a huge impact on the ISFP, right? Yeah. A huge impact on the ISFP as a child is able to transition from the early development program that they may have to the education-based IEP. This tool also helps the physical therapist determine where they are most efficient, where their lowest score is, that's where they're most deficient, so that's where we should focus our treatment sessions first. As they grow, the IFSP will follow them along with the results from their Battelle Index, and ideally you start to see improvement as you work on the different areas that they're lacking. The population that this can be used with is it's made for any ethnicity or group, as long as the child falls within the range from birth to 7 and 11 months old, they'll qualify to receive the testing. It can affect how they receive funding for school. If you're not a new English speaker, there is a Spanish version available of the Battelle Index, and you're able to administer the test. It may change the length of time that the test takes. The Battelle Index 2 specifically got rid of accessory questions or secondary questions that were asked previously. So whereas the previous test may have taken 60 to 90 minutes, the new Battelle Index, it takes ideally from 15 to 30 minutes long. Of course, it's patient dependent, but it may or may not take longer with a foreign language and use of an interpreter.
We found that the validity and reliability for the Battelle Index were very high. They used, 7 different other assessment tools to confirm that the Battelle looked at, it measured what it was said it measured, and the inter-rater was also high, and the test-retest was high. So when the scores took, 3 different scores were used to test, I think 140 kids, they found that they were like 95 to 98% accurate between the 3 different people. And also this tool is useful because since it follows them from birth all the way to 7 years, you can assess them early on and continually as they grow and see how while they're in the Part C of the IEP, IEP, then you can see how they're progressing and how when they transition into school age, what things you can work on. We found a study that was conducted by researchers using the Battelle Index on autistic kids. They were comparing the difference between normal and autistic relative to how they played in structured and unstructured environments. And the age range was about 36 months to 48 months. And the researchers wanted to find out the difference in play behavior between the two groups. And they used the Battelle to see where each child was at using the Battelle Developmental Inventory, and the test was able to confirm what age-appropriate development each child was at and help the researchers give reliable assessments of the autistic kids' child play behavior. This wraps up our presentation. Our test results for Isabella were conclusive that she was a normal little girl. All of her test results were found to be at a 2 for each question that we were able to do. There was one question in the gross motor where she received a 1, but overall we concluded that she's a healthy, normal baby girl.